Like many of our kids, I grew up in a family that was in desperate need of supportive services, and that was something that I never got. And so part of my career trajectory, I've always known that I wanted to work with children and that I wanted to support children in the child welfare system and provide an opportunity that I never had.
CASA makes children feel heard and gives them a voice. Whereas if they don't have a CASA, that's not always the case. While we're trying to manage several clients, they're trying to manage one client. And so we're trying to get services for all of our children and trying to get all of their needs, and each child has different needs, so they need different services, mental health, school services, IEPs, and CASA is just solely focusing on that one child to make sure they get all of the services that they need.
My CASA resembled more of a grandma than anything. She had a very loving, nurturing role in my life. She was consistent, she was solid, and she was supportive, and I felt loved. She showed up, and she never faulted on that. She was consistent with me, and she listened to what I had to say, which I didn't get much. So the fact that she had the patience to hear everything that I had to say was awesome. I think CASA aims to connect youth who need a sort of support or guide in their life, and to have somebody who's finally stable to be around them.
CASAs are really valuable because they're able to create really stable and consistent long-term relationships with their youth. The whole point of a CASA is to assign one CASA one time and have them stay with that youth for the life of their case. It also eliminates the need for a child to retell their story to a continuous stream of new professionals in their life. If you think about it in terms of doctors, we're sort of your general practitioner. Everyone else on a case is a specialist for the child, whether that's the vendor agency that approves their foster home, their medical doctors, mental health doctors, they're all specialists. But CASA is sort of the go-between for all of those people to make sure that each specialist has the same information about a child so that their care can be consistent across the board.
So while CASA continues to exceed our yearly goal of children served, there is still so much more room to grow, and there are still so many more kids that could benefit from having an advocate assigned. However, due to the limitations of supervising those advocates, what we really need is more case supervisors, and that would allow our capacity to assign advocates to cases to grow exponentially.
One of the things that really strikes me about CASA is they're working with children that don't have the type of parental situation I had when I was younger. My family was completely loving in terms of all the things that we did as a family. And when I found out and understood the impact that some of these children had, they're abandoned, they're abused, they're neglected, it really tugged at my heartstrings, and that kind of gave me an understanding that emotionally I felt I needed to do something to make a difference, to have an impact. And because of that, I have been continuing to volunteer my time and my energy for the organization and continue to provide resources in the form of donations to the organization. In an effort to assist with CASA's resources, my wife and I have made a 5-year commitment through an organization that CASA set up called the Community of Champions. It's a certain amount that you're pledged over a 5-year period of time to be able to help the children and provide the resources necessary.
It's a very exciting time at CASA. We are on the cusp of serving more children in 1 year than we ever have before. There are a number of ways that you can support CASA, whether that's becoming an advocate like Taylor and Lily, joining TED in the Community of Champions, or a one-time donation for Fund a Child.
It is my hope that many of you in the audience this evening would consider making that same type of commitment and pledge for CASA.